and he does not need any introduction when it comes to any autoimmune disorder or post-COVID illnesses, because he has been uh, tackling those things very well since the pandemic has basically hit upon. Uh, so post-COVID, as we have all known that pan-India, this inflammatory condition has hit, and post-COVID people have had many autoimmune conditions. People have had cardiac illnesses and whatnot. So their diabetes have come up and the thyroid has basically come up. Our next speaker is Dr. Praveen Saxena, sir. He's a clinical metal toxicologist. He's a managing director at Dr. Saxena Integrative Medicine Private Limited, physician for social responsibility. Over 20 years, he has an experience of over 20 years and has helped people with chronic health problems using latest advances in complementary and integrative medicine, which emphasizes science-based natural therapies in place of surgery and prescription medications. With vast experience in the field of radiology, he's an MD radiology himself in interventional approach. He has done extensive work in autism and vaccine safety also. Management programs using novel treatment procedures like detoxification, metabolic weight loss, non-toxic cancer therapies by tackling the immune modulation and nutraceuticals. He has also worked upon some external counter pulsation, non-surgical bypasses, ozone and hyperbaric therapies for addressing various ailments. His topic for today is post-COVID rise in autoimmune disorder. Let us hear from somebody who has been practicing both conventional and functional medicine into tackling these situations. Thank you so much, sir. Please go ahead.
Thanks, Dr. Karishma, and it was a pleasure always. It is a kind of IFM is. I thank really the organizers of IAFM. This is something which we were trying to work on that, because as Dr. Visalam has said, all of us have got into some of the autoimmune or some things and all that, your personal things. But as a radiologist, I'm trying to work on something. I'm yet to find somebody who is very healthy, in the sense there will be some small things. We as when I used to practice, I started my practice in 1994, radiology, and I used to do ultrasounds a lot, ultrasound, CT scans, and MRIs came later. But we used to have that fatty liver. We used to say that, okay, fatty liver, okay, no problems. You have diabetes, it's chalta hai. The thing is, this fatty liver itself is a big game now. This is what we are talking about, non-alcoholic fatty, this one, hepatic steatosis. And we used to tell sub aside all the clinicians and all that, okay, TK, what is the grade of fatty liver? So things have started. I started looking deep, trying to take a deep dive into that, trying to follow up these fatty liver patients who were non-diabetic. And we followed up for a period of time. And over the period of 5 or 10 years, they walked into diabetes. So I thought what we have picking up fatty liver is a pre-diabetic marker. And if I can use that marker, thing is, from then onwards, we started working on that. Yes, I started from 2003, my center, working both in alternate as well as conventional medicine. I think this is the best way across. What I tell people is take the best of both the worlds. You don't have to be very, very kind of this one rigid in your behaviors, because something happens and something helps something and something helps other thing. Really happy to listen to Visalam, amazing kind of thought. And that particular thing was, we are still trying to, only thing is, as doctors, we can't do every practice. We need to confine ourselves to our kind of zones and all that. But still, what this last 2 years was such a kind of thing. I was reluctant to take up any COVID case during the start. It so happened on 15th August, it was a holiday for us, but we normally, we worked throughout that COVID. I had some cancer patients, heart patients, and other patients and all that. One of my patient, who is my 14 years old patient, he said, I'm coming to you, and this is what. So it was a typical kind of cytokine storm he has got a, they were treating for pulmonary edema. It turned out to be something like ground glass haze. And still that was not it was, RT-PCR was not very confirmatory in that, because everything has gone into when you get into the lungs and all that, hardly you expect something in the nose. So this was the very third week we picked up, the patient was on second, after second to third week he came to us. Then we started looking at that, and I entered the arena. I started working on some integrative protocols, trying to work with likes of FLCC, trying to understand what is vitamin D. We started some kind of integrative medicine some years back, and along with Lenny, we have a think tank, and we thought, let us work it out on this vitamin C and all that. Karishma, I'd like you to open my screen. Yeah. So
Yes, sir.
yeah, yeah. So I'll be digressing a lot. So we will be talking here about something like vaccine safety, because something is like we are now listening to things like which we never like to listen to that. We have scores of cases of heart attacks. We have scores of autoimmune disease and all that. Can you forward, please, or you download that and you okay, fine. This is one thing when we are talking about this is the infectious diseases. It has always a kind of thing. I'd like to emphasize on one particular thing, which is called biological terrain. I keep telling everyone to fix your biological terrain. It is not the streptococcus B, which has to be for the throat. We need an antibiotic. If we are able to keep our biological the terrain stronger, the biological terrain stronger, I'll just give bullet points: cut down sugar, trying to work on your oral health, whatever, everything everyone has been listening to that. We need to work on all that pattern, trying to improve your biological terrain. This we have some things called inherent food allergies and all that. We have something called there is a innate immunity and so many things, but we are always at this particular thing because of antibiotics. There are some things which the biological terrain is not we are not fixing the biological terrain very well. I'm sure if you have a good biological terrain, we can go. So next slide, please. So the thing is, coming back to coronavirus, this is one thing which you people have to. I'm just not trying to. You need to understand from where it is coming. Looking at the chronology, it started in 2002, and they started looking at a vaccine for coronavirus, and around 2012. They had some 30 vaccines, and they shortlisted about 4 vaccines among them, and they started using that. It was the first guinea pig was the ferrets. Next slide, please. Ferrets was a like similar, like you have got a human biology. It's a good. They had all of them had a good antibody response, and they thought they hit the jackpot. Later on, something terrible happened. You know, this ferrets who had been vaccinated, they were exposed to a wild virus, which resulted in a massive kind of destruction. Next slide, please. So the thing is, this is what I always tell is you need to look back at the history. The history repeats itself. When we look into 1960s, RSV vaccine, this has got the similar kind of thing. And RSV vaccine, they got a good response and all that. But 2 children, they died. That led to abandonment of the vaccine. That was a FDA and NIH, both they have agreed upon that, and they said they are not going to do that. So the thing is, what is bothering us is there are a number of deaths. It is not just 1 or 2. We can always. I have in my practice. I know someone who had died in our thing. So many cases are coming, and still now there is nothing. Next slide, please. So this hepatitis, again, what happened was this attempted vaccine during that ferrets produces hepatitis, and they had. So what I'm trying to put across is that this is still an experimental vaccine, which was not yet proved for the ferrets also. Next slide. So what is the key take? What I started understanding about is something called ADE. And I remember Del Bectry talking in the initial days. We had a NVIC conference, and he was talking about ADE. I never understood what this guy is talking about, because we tend to take non-medical person not properly seriously. He was talking about ADE and all that, and antibody dependent enhancement and all. So blah blah blah. Then we realized of late this is one of the phenomena which is slightly causing a big issues. I think everyone has to look into this thing called ADE, which is causing vaccine-induced problems. Next slide, please. So what I put a scenario is, you have a COVID. I did have a COVID. I think I may be having some fever for a day or two, but everyone has kind of thing. They didn't enjoy it. They had a nasty cold for 2 days. You used all sorts of kada, everything and all that. You had low fever, low grade fever, low energy, but still everyone survived. And with that, you get a natural resistance, you get a natural immunity, you get a kind of lifelong immunity. Next slide, please. So this, what happened was all these people who had a natural infection, the subsequently these people were also forced to take this particular vaccine. So based on so many things, because still we are trying to talk about these things, actually measles causing, but when measles are causing something in Mumbai or Maharashtra, there were some deaths were reported. All these deaths were reported in a very malnourished kids who doesn't have proper food to eat. So this is one thing. Measles can be a problem for a kwashiorkor marasmus child. Much it can kwashiorkor marasmus child. Anyhow, will get a problem with the simple dehydration also. So I think this is something which was blown out of proportion, and everyone was asked to go for a thing. I will give you small take home things how you can deal with. Karishma, please. Next. So this post-vaccine, which we called as an immune modulation, to let the body develop those antibodies and cellular response. So this is has been on a study, and we have to really balance. I think when I gave an opening statement, nobody's healthy. I can always tell you, if I start getting into the trying to understand the microbiome of all the people, including doctors, we started doing that, Dr. Karishma. We picked up on not microbiome. 2003, we picked up something like vitamin D. We picked up some anesthetists, and we picked up some people who are working on the roads. And we were astonished. All the white collar people, particularly my friends and all that, who are doing who are a kind of they had less than 10 vitamin D levels. And I'm sure that this dysbiosis also is very prevalent among all of us. All of us have got some obesity, diabetes, and all that non-communicable diseases. Still, people are not, even if they are not into this particular thing, that is a bigger marker. So everything depends on this modulation of how things happen. So next slide, please. Next. So this autoimmunity and inflammatory syndrome post-vaccination is a kind of thing. It is induced by adjuvants. We can always talk about something called aluminum. We can talk about something like ethylene glycol. So many things. The major kind of thing. What I started working when I was working to pick the threads of autism was thimerosal, which was mercury. Now the thimerosal is replaced by something like aluminum, which has to be added to any vaccine. And it is one thing which is a nano aluminum, and it is crosses the blood-brain barrier, which is a very nasty thing. It is your blood-brain barrier doesn't work when we got in touch with something like aluminum. Next slide. So I think I don't want to go again and again. You know about the role of vitamin D. You are all, I think everyone has stressed adequately about that. Next slide. I think I'm talking about vitamin A, vitamin C. We tried giving heavy doses of vitamin C, and in some cases trying to work on that. I thought this is one thing I would like to tell about vitamin A is try to look into not synthetic vitamin A, try to look for the cis isomer, which is a something like cod liver oil extract or something like that. It makes a hell lot of a difference. If you are just taking some synthetic vitamin A and D, try to switch over to this cod liver oil and see the benefits. It will be an amazing kind of things. Next slide, please. Yeah. In fact, yeah, we are always talking about, and now we have to fight against this big agriculture, big food business, big pharma. And I have forgot to mention about telecom here. I think telecom also is one thing, which is this 60G and less than that is causing a big issues with our health. We are not able to, even if we don't have any predispositions and all that, just because of the exposure of that is making you considerable sick. And this is what I believe is everyone on, particularly who are not doctors, they need to understand this, how they are, even if they don't have a cell phone tower near them, even if they don't smoke, even if they don't drink, what is the role of a glyphosate, which is causing your health, your intestinal dysbiosis is not because of your faulty food habits. It's not because of this one. It is something like because of the glyphosate, which is inherent to any kind of agriculture practice, which is causing the issues now. So I certainly feel that because of this, all things, we have low vitamin D. You had high levels of lead. You had high levels of dysbiosis and all that. These are all the things which were we were perfectly. Corona was able to hit the target very well, and we were all defenseless during that particular thing. Next slide. I'd like to share one, a 53-year-old female. This was our old patient who had a hypothyroidism for 6 years. She was getting treated with the normal kind of stuff. That when she came to me, I looked into her autoantibody status. Next slide, please. We picked up something called, she had in September 2019. We thought this is having something like a complex problem, and it came. There is a high levels of TPO was there, and it was Hashimoto's was diagnosed, and she went on for some treatment and all that. Till January 2020, she was fine, and after this one, in October 2021, she came to me, and her TPO, which was initially 80 before, rose to more than 1300. We don't, and the symptoms were quite tough. Very severe fatigue. She developed a facial palsy after she had palsies before also, but this time it was quite severe. Next slide, please. Yeah. So this case showcases the importance of critical thinking. You have to look into what is happening with these people. We had scores of people like having a sacroiliac pains. You have got joint pains and all that post vaccine. Only thing is, maybe I thought I'm biased. So I started working on looking at how best I can pick it up as a radiologist. And I used to always think of what is the okay, this is a subjective finding. Patient complaints of loss of appetite, they have got fatigue and all that, but how do you quantify objectively? So we started looking at CRP, we started looking at lymphocyte count, we started looking at something like D dimer for every case, and we were trying to tell that, okay, this is fine, not a big issue. But the people who had high levels of lymphocyte count, they were more susceptible, and all of them, they got into some or the other problems. These are all the vaccine adverse reporting effect system things. Unfortunately, having worked in autism for the last 20 plus years, I don't think this adverse events is known to the people who are practicing medicine. They don't recognize. They said, okay, this is a patient is trying to tell something, we don't have to buy that particular thing. I had seen patient who had a DPT, post DPT, they had a there was a typical kind of fits and all that. Child was almost kind of comatose for 2 days, and the doctors are refusing to believe that this is. They said, okay, this must be some brain fever or something. It was really disgusting. And but whatever adverse reporting systems was reported, these are all from the other side of the world. I don't think our doctors, I don't want to say that particular thing, but they don't want to take a blame on themselves. There is no, next slide, please. So this is the effect. Dysregulated immune inflammatory pathways are the major thing, and this is how we need to work it out. Next slide, please. I had this is the question actually. This is Times Interactive. They have reported is abundant evidence that mass vaccination is only. So we need to really go back and look into things. Are we, what we have done is correct? I think this is for the policymakers. I would like to, and as a people, you have all the rights to ask why we were subjected to this particular thing. And at least, unfortunately, now people are not keen on taking that boosters and all that. I think this is a good thing which is happening. Next slide, please. So this is again, we don't want to put up a anti or pro kind of thing. We believe that whatever we should get is a safe kind of stuff. I tell my patient not to be totally be positive to over be positive or totally be negative. You can be practical. You have to see that if you have some inherent problems, you have got some hypothyroidism. I had seen a patient who has got something called this was a it was really a tricky kind of thing, and there were multiple. This SLE was there, and they took a vaccine, and everything got ulta pulta. It's not easy for a treating doctor to take that cases and try to work it out. Again, okay, this is something good, that there are some good forces are we have been as a what I can believe is we have our good immune system and all that, which is something protecting us. So next slide, please. So this is, I just wanted to give you example of Haiti. Haiti is a place where 1.4% of Haitians got the jab. It was and they had lowest death rates from COVID. And you need to learn from this kind of statistics. I got into statistics because of my friend Amitav, and he is a big kind of, they work on all SPM and that model, epidemiology model. Next slide, please. So this particular thing, again, I need to emphasize that this is it has happened in Uttar Pradesh. What happened was they didn't follow the all other protocols of thing, all the things what I want to tell, but they started giving something like a ivermectin. It happened in Uttar Pradesh as well as in Goa, and luckily I was the thing is we knew about ivermectin from 2015. I had been to Simon Yu, and he used to give ivermectin for all at this particular thing. Autoimmune diseases, he used to give autoimmune this particular stuff. And in fact, he has coined a term called ivermectin deficiency syndrome. So that was quite interesting. But use of these particular things was has really helped people, and it was fortunate that in India we don't have that kind of regulations. Ivermectin is still easily available over the counter. Next slide, please. So this is again statistics. I just wanted to tell about two important guys. We are calling Dr. Peter McCullough in this February in Delhi, and he's going to come. He's a cardiologist, and he's a big voice talking about not anti-vaccine, safe vaccine kind of things. He was all throughout. Robert Malone is not able to come, but these are the people. Robert Malone was the guy who invented this kind of thing, the technology. And I can tell you one thing about this technology is they had done a very foolproof system. And it was what, according to Malone, it was supposed to stay in the deltoid region only and produce spikes, antibodies, not in a continuous factory type. Whenever there is a kind of thing, there is an infection, so that they produce antibodies. But the stark reality is they had used something like lipid nanoparticles, and with that, the thing has entered into your spleen, your ovaries, your all the human bone marrow, as well as the brain. So there is a spurt in increase in numbers, what we are seeing about this autoimmune diseases, Parkinsonism. We are talking about now heart attacks, which was unknown for. Yesterday, there was a report. In fact, today's most of the cardiologists are talking about it's a long haul COVID, and certainly they are not aware about a thing called myocarditis or pericarditis, and which can easily be diagnosed by MRI. Not even just by MRI, we can always do some blood tests and try to pick it up. We need to do something called a TROP-T test, or we need to do something like a uh, uh, simple things can be picked up. So one thing which we are very sure is this is the spike proteins which is embedded in your system and which is causing it. We on the other side we have answers for that also. Next slide, please. So what happened? I don't want to get into that debate, because what happened was everyone was ready to suppress this ivermectin and hydroxychloroquine, chloroquine, and something was not. It was a fishy, we understood, and they were promoting all the things which was not which really caused renal failure and all that. Next slide, please. How to reduce this toxic? I think this will be the major thing. I tried to concise something. Next slide, please. This is for everyone. When you get a vaccine, I was talking Karishma yesterday during that autism kind of thing. The child who gets a DPT vaccine and over the skin, they get some redness and swelling also. And that particular time, you don't have to put paracetamol there. You need to just put ice packs. Putting ice pack on the site of the injection will block the immune reaction, and you can always you can take up that. If you are having some kind of irritation also, you can always use them. Next slide, please. I think this will be use a lot of fish oil. You can always take. Thing is, you need this. Fish oil should be given in a bigger doses. We try to talk about EPA and EHA, and this is studies are there which we can definitely block the inflammation. So at least you need to take for a week or 10 days if you happen to get a vaccine. That is the one thing which we thought. Let us start them with some melatonin 3 days back before, because all of had to because it was a kind of for travel, everyone had to take that. So follow up with fish oil. Try to use that cold this particular. Second slide. Next slide. You can always use all the things which we have discussed here: ellagic acid, curcumin, quercetin. Take lots of tea. You have got pomegranate, which has got good stuffs actually, ellagic acid and all that. So this is I definitely believe in curcumin and this quercetin and all, and it blocks the ability of the adjuvants to trigger a long-term immune reaction. Next slide, please. I think vitamin E is an important ingredient. Vitamin C, we had used, Sarah Mahil was on my show, in the sense we did a kind of Zoom, and we were trying to work on this COVID reactions and all that. She was the one who says every 2 hours you need to take oral high dose vitamin C. Unless you get diarrhea and all that, every 2 hours you need to take if you have got vaccine reaction or even you have a COVID. Next slide, please. Zinc, you had been, I think Lenny has told about this zinc. So many, I don't want to go into, these are all the normal things which we always try to use. Next slide. So I'd like to put something 2 minutes for question answers, because all magnesium, vitamin 3, everybody knows about this. Next slide. This is one thing. Yeah, I think we can stop there. Anything? Okay, there are some things which I'd like to, if time would have permitted, I would have gone into all the details. You can just slide, or you can take the copies of what that. I don't mind. I believe anything which I try to work it out, because we anticipate a lot of questions, because this is something slightly. I don't think it is much controversial. People are learning to understand that now. Okay, something is fishy. If there are any questions on the chat box, I don't see any questions here.
Yes, sir. Yes, sir. I
Yeah,
do
yeah.
see. Just one second.
Okay.
Thank you so much, sir, for sharing out the knowledge. As we all know, COVID has affected even the patients, the people, and the practitioners as well. Dr. Rujita is asking, could you please share your views on COVID vaccine and thrombosis?
Absolutely. I think thrombosis is one of the big things. I have not shared my other work actually, which I told about. We are picking up the D dimers and all that. This COVID vaccine, when we start with the spike protein, what happens is that it makes the blood more viscous. When it makes the blood more viscous because of the fibrin threads and all that, there is a big kind of work where this increases, COVID vaccine itself increases hypercoagulability. That is the idea of putting across. You need to always see that RBCs are just like stacked. I do something like a test which we call as a live blood microscopy, and all the cases of whom they have autoimmune diseases and all that, we made sure, and we were able to see the RBCs which were very clumped and all that post just something like hyperbaric oxygen or high dose vitamin C or hydrogen peroxide. Within 3 or 4 days, it was a big difference. Yes, post COVID is known to cause vaccine cause thrombosis, and we have a lot of peer reviewed studies. Vaccine causing myocarditis, vaccine causing thrombosis. I had 2 cases. We had sagittal venous vein thrombosis, One was having a 31-year-old software engineer, and he had post-COVID, he had it was like retrospective. He took the vaccine in January, which was Covishield. In the month of March, he complained of something like diplopia. And we picked up, went to a neurophysician, checked the MRI. MRI showed there is a sagittal thrombosis was there. Apart from that, there was a temporal infarct also was there. And this was done, all the kind of stuff was done. Later on, we picked up on our treatment, and he is doing fabulously now. We lost a 18-year-old girl in Hyderabad, which made quite everyone knows about this girl, which is Rachna's daughter, and she had it was a very a tough thing. She had a COVID vaccine. She took a vaccine. On the 5th day, she started having low platelets and all that. By the time we were able to pick up something in the brain, there was a massive hemorrhage and all that. Yes, and this case, particularly Rachna's daughter's case, we had documentation. What happened was we had we not asked for the parents didn't ask for a donation, organ donation, things would not have come to limelight. These people asked for a organ donation, and the report has come. In fact, the Supreme Court also intervened in her case, and it's a big case study. It's a known thing. It's a known thing. You should always try to use something like we were trying to work on commanding derivatives, work very well with this. Nothing works. Antiplatelet doesn't help. Heparin is not helping. We need to fall back to enzymes and try to work on some. These are the things which are helping these people. Best thing is to keep a check. What is the D-dimer levels? And every 2 months or 3 months, you should check your D-dimers.
Yeah, one last question, and this is an interesting one. Recently, many young people are actually losing their lives because of sudden deaths or cardiac arrests, and at times they are in the gym and they are losing their lives. They predict the vaccine is the culprit, or is it due to the vaccine effect, or is it due to something else? Would you put?
Karishma, I'll give a live example. I don't want to talk about the person was dead, because we don't do postmortem here and we don't know what's happening. We have a case who, in fact, he was around 50 plus gentleman, and he had a kind of ACS, and he went to the hospital at right time. Everything was a Bollywood script actually, and they said, okay, we were able to, from circumflex, a big thrombus they have removed and all that. 3 days back, before he getting into the hospital, they called me. We had some kind of fever and all that. So for every case, I tell, okay, you get my CBP, HSCRP, and all that. And in that case, this guy had a lymphocyte which was more than 42 or 45. And if at all, I have not, though they showed me the results afterwards, after 3 days of this cardiac and all that. This person is alive, he's rocking, he doesn't have any issues and all that. But still, what is the cause of thrombus, which has come to a normal person who is like a healthy individual, no family history, nothing like that? It cannot just come like that. He had blocks. He had something like de novo thrombus. And yes, when we look into some things, people like KK, people like Punit Rajkumar and all that, definitely they had post-COVID. What is happening is there is a pro-inflammatory state which is happening. And at that time, as Dr. Vivek has told, that we never advise them to go for a prolonged kind of stress. And this is one thing which is really tough. And we have seen some doctors also succumbing to thing. And it is definitely post-viral, or it is a post-vaccine. Post-vaccine induced, I'm so confident, because there is a report in MRI which is called late gadolinium enhancement, which occurs only with the vaccine-induced one. If it is a long haul COVID, you don't get that post-gadolinium enhancement on the lateral wall of the cardia. This is one of the clinching differential diagnosis we do. So for me, anyone having a sudden kind of this one, usually myocarditis, they get into electrical failures. They just go have a sudden ventricular fibrillation and they die. They don't have blocks and all that. Thrombotic episodes are also there. Arrhythmias and thrombosis is the most common cause. You need to always look, even if somebody has a small light chest pain also, it is mandatory you get a strop T, or you have to look into these particular markers. But because what happens is that 3 days later, okay, things get settled off. But this is a real challenge, and it's a real issue. This is post-vaccine complications are a big thing.
Thank you so much, sir, for your valuable time and your immense knowledge on this topic. There are some questions in the chat box. If you can wait for some time and just answer those questions.
Yeah.
Thank you, sir. Thank you so much. Thank you.